is Hidayah, and today I will be sharing with you about caring of patient with ileostomy. Ileostomy is when the large intestine of the patient is removed due to infection or maybe tumor. So the end of the small intestine, called the ileum, will be attached to the lower right abdomen, where an artificial opening called stoma will be made so that the feces and urine can pass through it and into a bag called the ostomy pouch. The feces of an ileostomy patient will be very liquidy and flow continuously because the large intestine is not there to absorb water from the chyme. So there's different types of ostomy bags that you can use, and it is up to the patient to choose which one is more comfortable and convenient for them. And for demonstration purposes for today, I will be using the one-part drainable pouch. Here are the materials needed before I put on the ostomy bag. I have wet wipes to clean the stoma, a towel to dry it off, a one-part ostomy pouch with clips on, ostomy paste, scissor, marker, and a stoma measuring guide. So first off, I'm going to introduce myself to the patient and the procedure that I'll be doing today. So hello Afiq, my name is Hidayah, and today I'll be cleaning your stoma and putting on the ostomy bag. Is that okay with you?
Yes.
Alright, so let's start with cleaning the stoma. The stoma should not hurt at all when touched, so check the surrounding area. If there's any redness, that should be reported immediately. And so the next step is I will be using the stoma measuring guide to measure the size of the stoma so that it fits perfectly on the ostomy bag. So I'm gonna make sure it's not too big or too small. I think this is the right size. So now what I'm gonna do is trace the circle that we just measured onto the adhesive part so that we can cut it off with scissors. What I'm doing now is removing the sharp edges of the circle that I just cut to ensure that it's not irritating the skin of my patient. Once that is done, it is time to remove the adhesive tape, and in this case, I'm using a double tape instead. Cut the hole. I will now stick it onto the patient's stoma. And usually, it's better to have the barrier ring or the ostomy paste, which I'm going to use. I'll pretend to use it. So you put the ostomy paste over here. This is to ensure that the stool or urine is not leaking from the ostomy bag. And once the paste is there, you can now put on the ostomy bag with the adhesive part. Slide it onto the stoma and stick it properly. One thing I forgot to mention is to put your hand on the adhesive tape for a couple minutes to ensure that it melts and actually sticks properly onto the skin. When the ostomy bag is 1/3 or half full, then it is time for you to drain out the content into the basin or into the toilet if the patient wants to do it himself. The way you do it is just by unclipping this and drain it out. If the bag shows signs of leakage, then you have to change it immediately. This ostomy bag can only last around sometimes 3 days, 5 days, or even 7 days maximum. When it comes to their diet, ileostomy patient needs to drink about 2 liters of water per day because they are easily dehydrated due to absence of a large intestine. For post-operative surgery patient with ileostomy, they need to avoid eating raw fruits and vegetables as it can cause blockage. But once they are healed, then they can basically eat anything they want. But certain foods can cause a pungent smell, such as baked beans, eggs, and asparagus. So that is all from me today. Thank you.